Hi, this is Tiffany Christensen. Today I'm going to be reading a chapter out of my book. The chapter is called Getting Your PhD in Patientology. I'm sorry to be the one to break the news. Gone are the days when doctors know all and we're at their mercy. When it comes to your personal care, it's your job to gather all the information you can on the consequences of different procedures, your medications, and your own body. That's not a suggestion. It's a necessity, and it could save your life. As a patient, the world of medicine is intimidating. There's a lot to learn and retain. You never know when a tidbit of information is going to play a key part in your medical drama. While you may not have the medical degree, you are, in many respects, the most qualified expert in the room. You know your body and your history better than anyone else, and it's to your benefit to assert your role as expert. Good medical professionals will come and go from your life. Make sure that you have enough understanding of your needs that a few not-so-good medical professionals won't prevent you from getting the care you require. The road to confusion is paved with Post-it notes. There was a time when I had a transplant coordinator named Betty, who left much to be desired. She primarily organized her patients' care with Post-it notes and always chose the path that required the least amount of work for her. I was on a downward spiral after recently being diagnosed with chronic rejection. My lung function was dropping almost daily, and the doctors were struggling to get me stabilized. In addition, I was having persistent fevers that were concerning because if my body's immune responses were too high, I could also go into another form of rejection called acute rejection. I went to clinic to address the fevers and was seen by a doctor who hadn't been on the team long and in the end didn't stay long either. His analysis was that the fevers were being caused by chronic sinus infections, and his solution was sinus surgery. Based on his conclusion, the wheels began turning to set me up for the surgery. I saw the ENT doctor, and he felt, based on my history, it would be a good idea to do the surgery, but not a necessity. We went forward and made the surgery appointment. The day before I was to go in, I had to go into the hospital for a battery of pre-surgery tests. I had one question on my mind that had never been answered. If my lung function was continuing to drop, wouldn't being intubated and going under anesthesia make that problem worse? I knew intubation and anesthesia were difficult to recover from when one was having lung issues. The tests I had to have done took all day and were at a variety of different places throughout the hospital. At each stop, I asked the caregiver when I'd be able to see a doctor and ask them my question. The answer was always, later. Finally, at nearly 5 p.m., I was at the final stop. I asked the nurse my question, and for the first time that day, her response was one of concern. She felt I had a valid question and encouraged me to contact my transplant coordinator. She gave me a phone, and I called. Betty answered, to my surprise, and I told her my thoughts. She exclaimed that she had a note on her desk to call me. At some point, she had realized I shouldn't have the sinus surgery until my lung function had stabilized. I reminded her that I was only hours away from going under anesthesia. She said she had simply not gotten around to contacting me yet. After we hung up, the surgery was canceled, and I went home. What if I hadn't been paying attention when someone mentioned the effects of general anesthesia on lung function? What if I had undergone the surgery and Betty got around to calling me afterwards? We will never know. I'm just glad I remembered the anesthesia issue and had pushed for the answer. In the end, my fevers resolved, and I never did have the sinus surgery. No detail too small. After transplant, there are many medications a patient has to take. Some of them have side effects, and some of them are counterindicated. For instance, the major immunosuppressant can't be taken with ibuprofen because the two together can cause kidney failure. This is something they try to teach you when you're learning your medications, but a friend of mine missed that lesson. After his surgery, he was having back pain and began to take ibuprofen to help. A few days later, his lower back began to hurt, and the pain extended all the way down the back of his thighs. Fortunately, he mentioned this at the clinic visit, and it was quickly discovered he was in early-stage renal failure. They were able to treat him and reverse the effects of the ibuprofen interaction, but he was shaken. This wasn't the fault of the doctors or nurses. My friend failed to take in crucial information that was provided to him. It can be easy to become complacent with your care and not think about the details. That approach can clearly lead to a world of trouble. Fear and trembling, I promise. I like to think of myself as a unique individual, but when it comes to my body, that really isn't a compliment. I can react to things very differently than most people. Some of that has to do with my emotional history, some has to do with my varying pain tolerance, and some has to do with my personal body chemistry. Only I can know how I will handle certain medications and procedures, and I have to somehow find a way to communicate these idiosyncrasies to those caring for me. At one point, I had a central line called a portacatheter. This was a wonderful device that allowed me to get IV medications with minimal pain and was far less invasive than having an IV in my arm. After my first transplant, this catheter was taken out since it posed a risk of infection. From that point on, I required a PICC line whenever I needed IV medications. This catheter is placed above the elbow and is fed in across the chest, stopping just short of the heart. For most people, apparently, this is no big deal. For me, it's incredibly painful. Between the existing scar tissue from past blood draws and IV catheters, and the fact that I'm very small, this procedure is at the top of my most hated procedures list. When it comes to getting a PICC line placed, I've become a Pavlovian dog. As soon as they wheel me into the room where it's done, I start to feel cold, tremble, and cry uncontrollably. This isn't a welcoming sight to those involved in doing the procedure, and makes it all the more traumatic for me. At times, I've even had this reaction when I'm simply filling out the paperwork. There have been doctors who gave me PICC lines that felt compassion for me. There have been doctors who told me I shouldn't be so upset. There have been doctors who did it very well, and it turned out to not be so bad. There were doctors who did it very forcefully, and I was in terrible pain for days afterwards. No matter what the circumstances, my reaction remains the same. I'm scarred for life when it comes to PICC lines. So what do? It's my job to convince them of the severity of my problem and make sure that I'm provided with the proper pre-medication. I need to be very sedated before I go in that room. It can take time to convince someone that I need this pre-medication, since that's not a normal request. Eventually, I may have to declare that I won't do it without the sedation. If that doesn't work, it's then necessary to involve my transplant doctors in the debate. Usually it doesn't come to that, but regardless, I won't back down from this demand. It's my body, and I know it better than anyone else. End of story. What I know now. Everyone knows that knowledge is power. In this case, knowledge can come in the form of medical details or a personal understanding of your own body's needs. When it comes to health care, it can enhance or even save your life. The more you can learn about your illness and the treatments, the better able you'll be to make informed decisions and ask the right questions. The more you pay attention and document the physical reactions you experience, the better able you will be to advocate for solutions to problems that are unique to you. Information can be gathered from other patients, the internet, reading books, and asking lots and lots of questions to the medical professionals around you. Take control. Knowledge is the first key in being an effective patient advocate.